Tonight, many people continue to pray for Congresswoman Sheila Jackson Lee. She's battling pancreatic cancer. According to the American Cancer Society, it's one of the most dangerous forms of cancer in both men and women out there. Tonight, we're learning more about the disease. Joining us to talk about it, the professor of medicine at the Baylor College of Medicine, Dr. Benjamin Leon Musher. Glad to have you here on The Factor Uncensored. Obviously, we're not privy to the Congresswoman's personal medical records. But for those who are wondering exactly what is pancreatic cancer, explain that.
Your pancreas is this long caterpillar-shaped organ that's towards the back of your abdomen. And along the duct in the pancreas, people can develop tumors, which can become malignant, cancer. And frequently they don't cause symptoms early on, and they like to spit cancer cells into the bloodstream very early. So while some cancers are caught on the earlier side, those cancers, for pancreatic cancer specifically, are caught when it's pretty late already. Either it cannot be cut out with surgery, or it's frankly already spread to other organs in the body. And that's what makes it particularly deadly. And once it spreads, it is not curable, treatable, but not curable.
Is there any kind of test, if you're just concerned if you may have this, now that the awareness is out there, that you can go take even before there are signs and it's not at the point where it's of no return? Are there any tests that you can take beforehand to determine that it may be developing in you?
It's a great question. That is a very hot area of research right now. If there are people that are particularly high risk for it, family history, other specific risk factors for it, genetic type syndromes, there are tests that can be done on a yearly basis, but for the general population, there's not yet a test that has been proven to decrease mortality on a society-wide basis. So the short answer to your question is not yet, but people are looking at these ultrasensitive blood tests combined with imaging tests and procedures, but not quite yet.
Now, what's the survivability rate once you have it? Are people surviving? Are people living with it?
Yeah, I've been treating this disease for about 16, 17 years, and we are seeing more survivors than we used to. Now, if it's caught once it's spread, the 5-year survival is unfortunately less than 5% for the time being. If it's caught earlier, when people can undergo chemotherapy and surgery, we're up to about a 40 or 45% 5-year survival, so that's better. The problem is we're not catching many of them early. So really, the research that's going on right now is really focusing on how can we kill these cancer cells that are floating around in the bloodstream, not just with chemotherapy, but newer targeted therapies and immune therapy. So we're getting better, but we have a long way to go.
Are there any experimental type therapies out there that doctors may be looking at, considering, or possibly using that may show some promise down the road?
Absolutely. As we learn more about what makes these cancer cells tick and how the immune system interacts with these cancer cells, we're developing newer therapies. So at Baylor, we have several immune therapy protocols and some other ones as well that really target cancer cells. Pretty much any major cancer center will have protocols or investigational drugs that are being given in a very regulated and organized fashion, so that it might not only benefit those patients, but also benefit society in general.
When I talk about pancreatic cancer, I always hear the word pain. Is it a painful illness?
Sometimes yes, and sometimes no. In fact, one more common presenting signs that we call painless jaundice, when someone turns yellow from the bile duct being compressed with a tumor. That frequently doesn't cause pain. On the other hand, once people have pain, that's not a good sign. That means that it's usually a little bit more advanced and may not be early enough to be cured.
All right. Dr. Benjamin Leon Musher, glad to have you here on The Factor Uncensored, and we appreciate your expertise and your advice.